Advanced assessment of mental health disorders, past medical history. JD denies having a history of eating disorders, sexual or physical abuse, or depression. Miss D denies recent trauma, illness, hospitalization, or surgery. She takes only aspirin for the occasional headache or muscle ache. Past health conditions or surgeries. Ask about past or ongoing health conditions. Some conditions, such as HIV or AIDS, may contribute to mental health disorders. Question about a history of mental health disorders, such as depression, generalized anxiety disorder, schizophrenia, bipolar disorder, dissociative disorder, anorexia, and bulimia. Ask about past surgeries. Trauma. Ask about past trauma, such as head trauma, CNS insult, birth trauma, spinal cord injury, and peripheral nerve damage. If the patient has a history of trauma, how and when did it happen? Was she or he treated? If so, how? Head trauma may result in neurological damage. Ask about the history of sexual, emotional, or physical abuse. Abuse has been linked to many mental health disorders. Assessing for violence. The healthcare provider should assess patients for signs of abuse and neglect perpetrated by one person in a relationship attempting to control or hurt the other. Such patterns are found across socioeconomic, ethnic, gender, and age groups and consist of domestic violence, sexual abuse, or coercion against elderly adults, teens, children, or intimate partners. Abuse also includes neglect, consisting of physical deprivation of care or emotional failure to provide verbal and behavioral expressions of love. Caring, empathetic questions by practitioners may open the door for later disclosure by the patient. Sensitivity to the patient's answers to questions about abuse is essential, and talking face to face is more effective than written patient questionnaires. The clear message must be communicated that the patient is not alone, is not to blame, does not deserve violent treatment, and that help is available. Following are some potential questions to identify and evaluate domestic abuse. Since our last visit during the past year or during your pregnancy, have you been hit, slapped, kicked, or otherwise physically hurt by someone? If yes, by whom? The number of times, the description. Have you ever been emotionally or physically abused by someone close to you? Within the past year, has anyone made you do something sexual that you did not want to do? If yes, who? Are you afraid of your partner or anyone else? In addition to physical signs of abuse, the advanced practice clinician should be sensitive to emotional or verbal clues to abuse, such as the following: wearing out of season clothing, family who will not allow patient to speak with practitioner alone, victim sits in a position that suggests fear or discomfort, sleep disturbances, attempt to avoid a particular person, fear of being alone or going home, recent weight change, passive or overly pleasing behaviors, post-traumatic stress behaviors such as hyperarousal, the startle reflex, nightmares, and numbness to emotions. Other signs of anxiety or depression, drug abuse, or eating disorders from the DSM-4 TR. The following elements of the SAFE acronym will also guide the assessment of domestic abuse and risk of danger. Stress in relationship. Is it safe with your partner? What happens when your partner is angry? Are you afraid at times? Have you been abused? What financial resources do you need? Is a firearm present at home? What do friends and family know of your situation? Emergency situation now. What emergency plan for escape do you have if necessary? Domestic abuse is one of the most common causes of complications during pregnancy. 1 in 4 pregnant women is physically abused, and the rate is higher when the female is a teenager. Be sensitive and alert to this domestic abuse and ask questions regardless of the setting or the reason for the healthcare visit. Medications. Does the patient take any medications? Variables affecting mental status include medications such as anticholinergics, corticosteroids, heart and blood pressure drugs, propranolol, central nervous system depressants like benzodiazepines, alcohol, illicit drugs, herbals, over-the-counter medications, nicotine and or caffeine, and unknown home remedies. Thank you for your attention.